Thank you guys so much for joining me here today. I've got Elizabeth Pollard, our Deputy Secretary of Science and Technology. I've got Deputy Secretary of Health Carter Kimble with me, and Secretary of Health Jerome Loughridge. Wanted to give everybody an update on our progress and fight against COVID-19 here in the state of Oklahoma. During this fight, my intent has always been to do two things. And number one is to protect the health and lives of Oklahomans, especially our most vulnerable population. Number two is to mitigate the impacts to Oklahoma's economy and get Oklahomans safely back to work as quickly as possible. Last Friday, many parts of our state started to safely and responsibly reopen. When we made the announcement, the Open Up and Recover Safety Plan, we made it clear that we will make decisions based on data in the state of Oklahoma, not what we're seeing on television. We've made it clear that we will continue to track data and adjust our plan if needed. I want you to know that the data continues to show we can safely proceed with phase one of our plan to safely and measurably reopen on May 1st. Our hospitalizations, I want to show you this slide here, continue to decrease. When we announced our surge plan back on April 10th, we showed this exact slide. We were expecting to need 1,100 hospital beds at that time. We built our capacity for 4,600 just to stay proactive. Because Oklahomans did such a fantastic job of social distancing, working from home, making sacrifices. I know Oklahomans made a lot of sacrifices over this last month, from missed graduations, from all the things that we've had to sacrifice for. Oklahomans have done a really good job. And because of that, we have flattened the curve. Our hospitalizations peaked on March 30th in the state of Oklahoma at 560 and have slowly trended down this entire month of April. Today, we sit at 288 hospitalized COVID patients across the state of Oklahoma, even though our capacity we've built for 4,600 hospital beds. The White House guidelines, they have 4 gates for states to safely reopen, and we continue to hit all 4 of them in the state of Oklahoma. I wanted to go over those with you. Gate number 1, this measures how many people are going to the doctor and reporting symptoms. It's a downward trajectory of influenza-like illnesses and COVID-like syndromic cases. So you can see the trend line is going down there. Both of these continue to trend down. Gate number 2 covers the number of cases. It's a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive test percentage. As you can see, our 7-day rolling average is going down for the month of, since April 10th was the date that we started to measure 14 days from our announcement last week. And we're continuing on that downward trajectory. Here's another thing Oklahomans need to keep in mind. We are testing significantly more people each week. So we're going to continue to still find cases in Oklahoma. I've been consistent with Oklahomans. We still have coronavirus in the United States. It's still in the state of Oklahoma. We're still going to have people get this. We're still going to have positive cases, but our rate of positive cases continues to decline. When we first started testing, more than 10% of everyone that we tested came back with a positive test. Now, for every time we test someone, it's coming back at 6.1% are positive. So in other words, for every 1,000 people that take a test, 61 are coming back positive. That means 939 are coming back negative. Last week, we increased our testing by 36% from the week before. What's exciting about that, and we want to continue to increase our testing, but our total number of cases actually declined. So the week of 4/17, we tested 13,000, and we had 676 new cases. The next week, we tested 36% more, but yet our positive test cases went down to 656. The final gate covers hospitals. The White House metric is that we have to treat all patients without crisis care. Again, we have 288 patients compared to 4,600 hospital beds in our state. The second part of that is testing in place for at-risk healthcare workers. I'd like to invite Elizabeth Pollard, our Deputy Secretary of Science and Innovation, to come give us an update on some exciting developments that we've got going here in Oklahoma.
Good morning. So it was just 6.5 weeks ago where we had completed just a few hundred tests for COVID-19. And today we will pass the 60,000 test mark. It's a very exciting accomplishment, going from the bottom of all states in the US to right in the middle of the pack. And we will continue to improve upon that in the coming weeks. We have done that by partnering across the state. We've shared our relationships with OSU, OU, with the Public Health Department, and really driving strategies to leverage the technology that's in place at those universities, and then creating commercial partnerships with reagent suppliers to be able to test as many Oklahomans as possible. One of the big announcements for today is that the diagnostics laboratory at OSU will be submitting a EUA for saliva-based PCR testing. So this allows us to now move from nasal swabs to saliva testing within the state. This is a huge benefit, especially for those long-term care facility residents where getting a nasal swab can be challenging and uncomfortable, but it also allows us to more quickly and adaptively process samples as people are coming through what we've called our swab pods, which may not be an appropriate term going forward. But we took the opportunity to look to Rutgers University once again, where we developed a relationship with the Dr. Andrew Brooks Laboratory at the RUCDR Infinite Biologics Lab located there. And he is the first lab in the country that announced that they had validated saliva-based testing and have replicated the test that they have put in place at the diagnostics facility. So as early as tomorrow, we will begin testing saliva-based samples. Very exciting. Another opportunity that we're working on is to enable more swabs in the state. We have been working on 3D printing of swabs within the OU and OSU communities, and we're hoping to have those validated soon. Last but not least, we have also begun doing serological testing and started some surveillance testing randomly across the state 2 weeks ago, and we continue that this week. But we will be focusing on specific zip codes going forward with known patients through a partnership with ODI under an IRB study to really understand the spread of COVID-19 across our population. So a lot of great accomplishments. I'm going to now turn this over to Carter Kimble so that he, Governor? Sorry about that. Governor, thank you.
Thank you so much, Elizabeth. So proud of you guys and what you're doing and partnerships you developed with Rutgers and making Oklahoma the leader that we know we are in testing to make sure we keep Oklahoma safe. So you guys are doing a great, fantastic job. Yesterday, we started shipping pallets of PPE to nursing homes all across the state. We'll have more than half of them out the door today, with the other half going to the rest of our nursing homes tomorrow. These PPE kits include masks, gloves, gowns, and face shields. They will be so important as we continue to protect our most vulnerable population. We've tasked Carter Kimble, our Deputy Secretary of Health, with coordinating our response to nursing homes and long-term care facilities, and his team has been making tremendous progress protecting that most vulnerable population. I asked Carter to come give Oklahomans an update on what's happening in our nursing homes.
Thank you, Governor. The long-term care response team is driven by a single mission. That mission is to protect our most vulnerable citizens through mitigation and prevention. In order to accomplish that, there are really four key areas that have to be addressed. That is protecting personal equipment, testing, admission and discharge protocols, and then supporting the long-term care facilities themselves, whether that's via staff or supplies. First, to the Governor's point on PPE, we were able to push allotments out to every facility in the state that should supply them with 5 to 7 days of PPE. In coordination with that distribution, we have put out stronger protocols for PPE usage. This would include mandatory face masks for facilities, even if you don't have a COVID positive case in the facility. This is one thing that initially we were concerned about supply, so we couldn't be as prescriptive in that, and now that we are more comfortable in our supply of masks, we feel this is the right thing to make sure that we don't have new facilities crowded with cases. Second, testing, and Deputy Secretary Pollard had already mentioned that we're moving to saliva testing this week. Our goal is to test all 42,000 residents and staff in long-term care facilities in our state over the next 30 days using this saliva test. It is a game changer just in the logistics of going into a facility, how quickly we were going to be able to test all in that facility. So we're really excited about that. With regards to testing, we will prioritize the making sure that 100% of our COVID positive facilities are completed before we move on to what will then be a regional approach for testing the rest of those facilities, staff and residents. Next is the admissions and discharge protocol. This is the coordination really between hospitals and other healthcare facilities as members are coming back to the long-term care facilities. It's important to remember that there are two predominant ways in which COVID-19 is able to enter a long-term care facility. One is through staff, and that's really where the personal protective equipment comes in. The second is if a nursing home resident has been to another healthcare setting and is coming back into that home. So we put out a decision matrix for hospitals and nursing homes to coordinate on how discharge and admission protocols are in place. That guidance went out last week through a health action alert. Lastly, in supporting our long-term care facilities, through partnership with the National Guard and support that they have, we have teams, disinfection teams that are really able to go in and do a deep clean, a chemical deep clean to facilities, whether it's a particular wing or area, to make sure that that disease is eliminated within the facility itself. The second piece, and really kind of the tip of the spear, if you will, in this war, is 11 rapid response teams that are regionally deployed across the state to be able to go into facilities and provide on-the-ground support in a various manner, whether it's helping cleaning, staffing, testing, education or training on PPE use. Those teams, staffed predominantly by the health department, but also in partnership with medics and the National Guard, are across our state and are already in place. We have a long way to go in combating this virus, but it is important to remember that fewer than 15% of our long-term care facilities have cases currently in them, and our goal is to make sure that that number does nothing but go down. Thank you for the opportunity to serve.
Thank you so much, Carter. You guys are doing a really good job, and we had a good meeting yesterday with the Nursing Home Association and some of their folks. Also want to thank our teams, like Carter said, from the National Guard, the State Department of Health, for what they're doing for tracing, surveillance, and then that deep cleaning that the National Guard is doing throughout all of our nursing homes is going to really move the needle for us. But nursing homes and long-term care facilities really present unique challenges for a lot of states across the country. But we're committed to protecting our most vulnerable populations, even as we open up and recover safely here in the state of Oklahoma. I also want to give an update on the 294,000 Oklahomans who have filed for unemployment benefits. Last week, we processed 116,000 unemployment claims, and on a system that was designed for about 2,500 in any given week. We paid out more than $307 million in benefits since this pandemic started, and we're working to get the claims paid as quickly as possible. I know the frustration and the anxiety many Oklahomans are facing with bills that are coming due right now, people that are out of work, they're waiting for their claims to go through. Our entire digital transformation team has been working night and day along with the unemployment department to get those claims processed quickly. Last week, we processed more than 70,000 of the 129,000 claims that needed a Tier 2 review, and we've hired an extra 200 help desk workers to get the rest of those out the door. You can always check on the status of your claim at oesc.ok.gov. I encourage you to all double check your information, because a Tier 2 claim likely means something on the claim doesn't match what we have in our database. We're also starting to pay the PUA claims. Those are for the independent contractors or self-employed folks who are not eligible for traditional unemployment. And we hear your frustration. I'm personally engaged and involved with the team that's over there that we stood up at the unemployment department to help with that. I'm getting daily updates to make sure we get those processed as quickly as we can for Oklahomans. From the beginning, my first priority has always been to protect the health and the lives of Oklahomans. And as we open up and recover safely, I want everyone to know we're not out of the woods yet. And like I said, we still have coronavirus in the United States. It's still in Oklahoma. So we have to continue to be cautious. We need to continue with social distancing, with washing our hands, staying home if you're sick. And I want to remind Oklahomans, get tested. If you have any kind of symptoms, or even if you just want to see if you think you should get tested, we have plenty of testing in our state. Call 211. We have over 80 facilities set up across the state. We need more testing. More testing is great for the surveillance. And even if you're asymptomatic and you just want to get tested, we encourage you to do that. Call 211 and it'll tell you where the closest spot is to get tested. So again, we're going to get through this, Oklahomans. You have done a fantastic job over the month of April. And so it is time for a measured reopening, but we cannot let our foot we can't be lax about this, because the COVID is still here in our state. We're going to be very cautious with our social distancing, but we will get through this together. So God bless you. God bless this great state of Oklahoma, and I'll open it up to a few questions.
Governor Stitt, is 2 weeks long enough to see the impact from phase 1 before heading into phase 2? We know some people can develop symptoms, 2 weeks after they come in contact with someone.
Well, the 14 days is something that the White House has laid out as one of their gates. And the important thing is we're going to be watching that data. My health department is watching the stats, the leading indicators on the percentage of positive tests that we're doing. And if we see anything move in the other direction, we can always extend those phases out. But we think 14 days with the research from the White House guidance and our own experts in the state, that's a reasonable time to kind of watch the data as we measurably start opening things up.
Governor, are you concerned Tulsa County has always told us that we would peak today as infections and then mid-May hospitalizations. Are you worried that you're opening the door a little too early? I mean, it kind of seems like, it feels like we're eating the birthday party without cutting the cake, almost. Are you worried this is too soon and the numbers are just gonna climb?
Well, these are tough decisions, and I know a lot of folks are concerned about the decision, and it's easy to delay or say, hey, we should push this decision making out. But the facts are the facts. You got to remember why we did 15 executive orders. On March 15th, I signed the first executive order that said this is a state of emergency in the state of Oklahoma. It's why I said the safer home population. And there's 15 executive orders for a couple reasons. Number one was to build capacity in our healthcare system, to make sure that we did not overspend. It was also to start building supply in PPE, and it was to flatten the curve. It was never to have 0 cases in our state. That's just not practical. But it was to make sure that we were healthy and we were responsible and we were having capacity in our hospitals. So the fact of the matter is we peaked at 560 hospital beds on March 30th, and we've continued to see that trend go down. And we have 288 hospitalized folks across the state, and that's too many. I want that to be 0. But when you build the capacity of 4,600, we think it's time for a measured reopening, and we're going to be data-driven on what's happening in the state of Oklahoma. And we reserve the right to push those phases back. But we feel like it's the right time to take a measured reopening stance.
Governor, there's been a lot of talk in Washington about sending more money to states, as much as $500 billion. The president seems resistant to that figure. What are your thoughts? I mean, obviously, what we're spending here is not cheap.
I spoke with the president yesterday, and I told the president that we need more flexibility in the CARES Act, which is the third stimulus package. It was $2.2 trillion, and it gave each state at least $1.25 billion. But there was a lot of strings attached. It was only to pay for COVID-related expenses, which is great. So everything that our state has spent on COVID-related expenses will be reimbursed. But I asked for more flexibility with how we spend that, because our municipalities with sales tax revenue are greatly affected right now across our state. But so before we went to a fourth stimulus, I just told the president, this is my opinion. I'm sure there's some other governors that would agree with me. Instead, you go back and put more debt on our children and grandchildren. Let's see if the third CARES package actually is working. If it gives us more flexibility, we think that would be what we need in Oklahoma instead of a fourth package.
Governor, you talked about the unemployment issues that are going on. We continue to get lots of emails at the station about, I can't get on the line, I've got my card, there's no money on it, it's been 3 weeks and I still haven't gotten my card. You addressed it, but your thoughts when you hear things like that?
Yeah, it's very frustrating for me as well, and I talked to some House and Senate members. They're getting calls from their constituents. I know you folks in the media are getting calls as well. That's why I put my best team on it. I've got our digital transformation team on it. I've got Steve Hart and his team, David Ostrom and his team. We've got over 200 employees on top of that department helping get through the backlog. You got to remember, that department was built, we would have average about 1,800 a week, and this is just unprecedented time. So we've gone all the way, we got 294,000 claims just since March 15th. So we had to stand up a whole new call center. I'm excited about that. We've got those wait times down. We are waiving, and we're going through some batch processes to get those out. And you just heard we got 116,000 claims out yesterday, the PUA claims. We're one of the first states to actually get those out the door, so that was a whole new system. You never were normally allowed to get unemployment if you weren't a W-2 employee, if you were a contractor. That was a whole new system we had to stand up. So I hear Oklahoma's frustrations. I'm getting daily updates. I've got our best team working on it. And we've got some great employees over there. We just had to work through some of those technology issues that were really, really old and antiquated, and we weren't built for this many claims. We also, don't want to get too technical, but the vendors that were providing those cards, also we're doing that for tons of other states. And that also got backlog as well, so we're looking for either printing checks, standing up and printing our own cards here to get those out to Oklahomans quicker. I'm trying to waive every requirement I can from a federal relationship level, because I know how important it is right now to get those dollars in the hands of Oklahomans who are trying to pay their rent and have their own obligations and lost their job due to no fault of their own. So I'm with them, I'm on top of it. We are getting the team together to get those claims processed as quickly as possible. So be patient, give me another week, and I want to have this thing wrapped up, and I want to have those claims out.
Governor, could I ask Secretary Loughridge or maybe Secretary Kimble a question? April 7th, we were invited out to the state strategic stockpile where the PPE is located. It's going to be 85 degrees today. It was rather warm there. I remember there's some big fans. Is that facility, does that have central air conditioning? Because I know on the packaging for a lot of PPE, it says 86 at the top temperature. So is that a consideration as we move into the warm summer months?
I don't know if that facility has central heat and air or not. We will circle back, but to the extent that that's an issue, we will certainly move those and can potentially receive those shipments in. As we know, those are moving in on a daily basis. But to the extent that that jeopardizes them, we have protocols in place to make sure that we stay within boundaries. So, good question. I can't stipulate as to whether there's central air or not, but what I can say is our response will be to protect those stores. We work far too hard with far too many people to jeopardize those.
Thank you, Secretary.
I got a question about a graph. Can we pull up a graph real quick? It is 7-day rolling total for COVID-19 new cases. Sure. Pull that up real quick. It's the one with the numbers on it. That one. So if we look at last week, there were some days above the trend line. Can you tell me how going above the trend line is still a downward trend? Can you explain that?
Yeah. Here's a great example. You can't just look at one day, because you also have to look at how many swabs or testing we took. So for example, on Sunday, we only took a lot of the 80 test sites because of demand are closed on the weekends. We took, let's say, 200 swabs, and we had 26 positives on Monday morning. Well, on Tuesday, we had 130 positives, but we took 2,100 or 2,200 test samples. So again, there's not just one gate to look at. But as you can see, 806 down to 655 is a downward trend. And it's a 2-week average. And so you can't pull out one day or one little bump and say that's a trend. That's why it's a 14-day average, and that was the gate that the White House rolled out. But you also have to think about how many swabs and how many tests we're doing that day.
Governor, I was wondering if you, actually 2 questions. The first question, can you comment on, very hard to talk. Okay, but first off, Mayor Holtz and Mayor Bynum both sort of reluctantly adopted the ours plan, and some of their comments and it indicated that maybe they weren't jumping into it wholeheartedly. So I was wondering if you could comment on that. And then this question may be better for Elizabeth. I'm curious, how many can be tested with the saliva testing?
Good question. You know, I've got a great relationship with the mayors across the state, constant communication with the municipal league, and I've had personal conversations with both the mayor of Tulsa and Oklahoma City, as well as other mayors. And these are tough decisions, and I get it. They're tough decisions on when to safely reopen. And I'm going to be data driven, but I've never been heavy-handed with mayors across the state. Some mayors, as you know, I'm putting out guidance for the entire state. Some mayors chose to be more restrictive, and that was okay. They have it closer to their communities, but we're putting out guidance for the entire state. And you saw last Friday we had some personal care businesses open by appointment only, but we didn't mandate that. And that's just not who I am. This is a guidance. It's a collaborative effort, and we've been sharing data with mayors from the two largest cities the entire time, and been very transparent with them. I believe, I can't comment to exactly what they said in their press conferences or why they said it, but I believe that they're on board to safely reopen on May 1st, and we think that's the right measured approach.
Are you concerned that some people took your announcement last week to be an all clear message?
I sure hope not, because I'm going to let Elizabeth Pollard answer the second part of Carmen's question. But, I've been very clear with Oklahomans. We cannot take our foot off the gas here. We have done a great job in early April. I said, the better we do in April of social distancing and working from home and, limiting our trips outside and those kind of things, the better off we'd be and the quicker we get back to normal. But I've always said, we still have COVID in Oklahoma. It's still in the United States. People are still going to get it. We have to be cautious. I'm going to continue to update Oklahomans every week and give them the data, what we're seeing on our trend lines. We cannot overwhelm our healthcare system. And remember, that was what we did in the very beginning to try to protect our healthcare workers, the system, because in March, they were predicting 5,000 hospitalizations. If you remember that, the modelers early on were predicting we were going to outrun it. That just hasn't been the case because Oklahomans have done such a fantastic job. But we're not out of the woodwork, so I don't want anybody to misunderstand me. We have to continue with the social distancing. It's a measured reopening. And on Friday, we'll have some dine-in restaurants. We'll have some things. They'll be spreading out 6 feet apart. We'll have disposable menus and those kind of things, and extra cleaning and masking of the folks. But we will watch the data. We think it's time for measured reopening, and I believe that Oklahomans are with me. They understand we have to do this. They also understand it's not time to take our foot off the gas. And let me bring up Elizabeth.
So as we discussed partnerships, one of the partners that we have in place is a service provider called Microgen DX located in Lubbock. And we have contracted with them to do all of the long-term care facility saliva testing over the next 30 days. But incrementally, of course, we have the OSU Diagnostics Laboratory that can process well over 1,300 and can scale up from there per day. So there's a huge opportunity for us around the saliva capacity that we have. Thank you.
And that just does. Do you understand, just to reiterate or underscore what she just said, we made the decision to test all of our nursing home patients and the healthcare workers inside our nursing home facilities as a proactive step. And that saliva test, we're I think the only state that is doing that in our nursing homes versus the more invasive swab test, especially on our elderly population. It can be very combative, it can be a problem. And so we really wanted to get the saliva test up and running for that most vulnerable population.
Governor, we've had some readers asking questions about your governor's bounce back advisory group. There are basically two groups. One group in the state that's been heavily affected economically by the pulling back, by social distancing, and then there's another group, mostly essential care, essential workers who are working in hospitals and nursing homes that are at great risk right now because they're still going to work. So our readers have been asking about why there's such a imbalance on your governor's bounce back advisory group. There's mostly groups of people on there who have an interest in getting the economy going again. And our readers have noticed a lack of people on there who would represent whole groups of people who are in great danger right now delivering essential services. How did you go about picking that group anyway? And why is there such a kind of imbalance there?
Well, I need to look at the list of who it is, but that's set up from our Secretary of Commerce, Sean Copeland. And if we have an industry that's not represented, that's not our intent at all. Sean Copeland is extremely inclusive, trying to get rural, urban. But if we need some more healthcare advisors on the group, and we've overlooked that, then I'm sure that he would add those to the group to get their input, because we certainly, that was never an intent on a safely reopening. And I can assure you that group is also talking, and we're running everything through the data that our advisors on the health side tell us when it's time to do it.
One black person, one Hispanic person on there. And those two groups make up a lot of our essential workers in the state. So that was the nature of the question. The other thing is, AP came out with a report that included Oklahoman about $2 million in hydroxychloroquine being purchased. Why was that purchase made? $2 million sounds like a lot of money right now that we're looking at uncertain budgets in the future.
Yeah, you've got to understand that my goal as the governor is to protect the health and lives of Oklahomans. So in early March, I set up my Governor Solution Task Force, and I brought in a czar for PPE, and Gino DeMarco. He's done a fantastic job. And I told him to go out and get procure gowns, gloves, N95 masks, build up the strategic national stockpile. We knew we were getting reimbursed for that. But part of that also in early March, hydroxychloroquine was also showed to be a treatment. And so we went out and procured that as well. Now there's some other evidence that the chloroquine may not be as effective. But I was being proactive and to try to protect Oklahomans. And so that's always going to be my first instinct to get the equipment and the things that we need that I'm seeing for a future that would help Oklahomans.
So what do we do with it now? Do we get a refund, or do we send it back? What happens?
Well, it's still trees. I'll let Secretary of Health answer that.
Yeah, thank you. So the decision to purchase that particular treatment was not simply the governor's or even the advisors. We were relying, again, these were early days, on the opinions of physicians. And so individuals like Dr. Chansall, infectious diseases over at Integris, have opined on the fact that, particularly in those early days, the likely efficacy of that treatment regime could have helped at that point. And so as the governor has said, when we were battling sort of a fog of war at that point, we certainly inquired on the potential that it would have utility. Now, what can be done with that? As you probably know, hydroxychloroquine is useful for any number of other ailments, to include things like lupus, other autoimmune diseases. And so that money will not have gone to waste in any respect. And so, we have that now within the state's borders for the potential that we might see another surge, and that it's pretty useful for COVID-19, but it's also more generally applicable for those other diseases as well.
Take one more. Cover right. I guess I got one. Mentioned health professionals, Secretary. I think on Sunday you were on Fox News with Chris Wallace, and he asked you kind of about the statement that his name is Dr. Monks who's the new president of the Oklahoma State Medical Association, had made, kind of questioning the decision to reopen, and your response was that you didn't know who he was, and I'll admit I wouldn't know him from a pile of wood either, but he is the new chairman, the new president of OSMA. That is an organization of the state's doctors. Have you talked to him? Do you have a plan to kind of get with them and try to talk to them about these things?
Well, yeah, that's exactly right. I did not know him. I don't know him. He just took over that role. So Dr. Larry Bookman was the former president of the Oklahoma State Medical Association. He's the one that I had a relationship with. And even as of yesterday, on their own website, it still had Dr. Larry Bookman as the chairman of that organization or the president of the organization. And so, but again, there's a lot of organizations. We take input from all those, but we're going to be relying on our Department of Health, and we have the Governor Solutions Task Force that I get briefed on every single day. We're gathering data from all across the state. We're following the 4 gates from the White House before we make these measures reopening. Secretary, do you want to say something just real quick?
Important to note that Dr. Monks, again, began, I believe, on April 14th, was the transition from Dr. Bookman, with whom the governor had, again, a great deal of contact. But I just wanted to reiterate that Dr. Monks joins a group, other providers, representatives from the OOA, from dentistry, from nursing, from pharmacy, with whom we have multiple times a week conversations. So we have been engaged with Dr. Monks. So the fact that the governor had not yet had a chance to engage with him was really a function of the newness of him in that role.
Sure. Thank you.
Thanks, everybody.